Sometimes your busy life makes you unable to go to the hospital periodic health examination, or for some reason you can be subjective and ignore it. Only when the body calls for help do you notice. According to the experts, when you have pain, you just have a checkup. At the time, things could have become serious. Therefore, a self-health check at home is very essential and you cannot be unaware. You do not need to go to medical facilities, hospital, or use expensive equipment to have a checkup. Leading experts revealed that these simple home health checks will help you detect many diseases from vitamin deficiency, anemia, respiratory disease, osteoarthritis early to other dangerous diseases such diabetes, heart disease, stroke. From there will be timely and appropriate treatment. The following, industry's leading experts reveal these extremely simple but really effective home health checks that anyone can do by themselves anytime, anywhere. 1. Check your risk of heart disease. While climbing stairs while talking or singing. Climbing stairs is always appreciated by experts for the benefits it brings to health. So when you climb the stairs, take advantage of this opportunity to check your heart condition too. To take this test, you just need to climb stairs while talking or singing a song. If you feel stressed, have difficulty breathing, have difficulty speaking or singing, or have chest pain, get to the hospital as quickly as possible. According to Dr. Jennifer Cottle, associate professor at Rowan University's College of Bone Medicine, this test not only measures heart health, but also shows whether your lung condition is good or not. Maybe these are signs of asthma and bronchitis. Hand touch toes. You sit firmly on the floor with your legs stretched out in front of you. Then press your body close to your feet and reach your toes with your hands. If you are unable to do this test, it means you have a higher risk of heart problems. Experts at the University of North Texas explain that, because the friend is too stiff, so hand cannot reach the leg. Because your body's arteries are less elastic and the blood circulates slowly, the heart has to work harder to pump blood through the body. Long-term risk of heart attack and stroke. To improve this condition, straighten your body before bed, your health will improve significantly. Measure the ratio of your waist to height. First, measure your height using the string and cut the length of the string you are. Then, fold the string in half, then check to see if it wraps comfortably around your waist. The golden rule is that your waistline should be less than half of your height. This waist-height ratio is a more sensitive measure of health than weight alone or calculates BMI, because it takes into account fat distribution. If this double strand is not enough to wrap around your waistline, then you probably have a lot of visceral fat. High visceral fat levels are a warning sign of a high risk of heart disease and type 2 diabetes. 2. Check for stroke and memory loss risk. First, stand upright with both feet, then bring one leg back and tilt it 90 degrees from the other leg. Do not close the eyes and stay in this position for 60 seconds. If you are unsteady and unable to hold on even in your 20s, there is a high chance you will be at increased risk of brain disease in the near future. Because according to a Japanese study, 30% of people who cannot balance on one leg have the thyroid in their brain. More specifically, it is an early marker of the risk of stroke and dementia diseases like Alzheimer's. Although these are only the first signals, it can have an immediate impact on the patient's balance, health, and memory. 3. Check for signs of diabetes. Touch your toe with a pencil. The test is very simple. Use the tip of the pencil and touch your toes. If you have numbness or no sensation, be careful, as these are the first signs of diabetes and nerve damage. According to Dr. Cottle, in addition to detecting diabetes, the test also shows signs of diseases like lupus and infections like Lyme. You can ask someone else to do this test for you, stabbing the tip of the pencil into any one toe, as long as you cannot see. If you find out which toe has just been stabbed, the toe feeling is still good, otherwise seek medical attention immediately. 4. Check for thyroid risk. Place a piece of paper on the back of your hand. Shaky hands can be a pretty sure sign of a number of common diseases such as Parkinson's, overactive thyroid, vitamin deficiency, hormone problems, and more. To check this correctly, you place a thin sheet of paper on the back of your hand and watch. If the hand is shaking, the paper will vibrate, very noticeable. And if you find this unusual, you should also see your doctor where the health problem is located to treat it promptly. 5. Check the risk of anemia, blood pressure, brain, and more. Lying and then getting up. According to Dr. Cottle, dizziness when standing up is one of the signs of iron deficiency. maybe even anemia, low blood pressure, dehydration. So check yourself by lying down. Immediately sit up on the floor and then lie down again quickly. If you have symptoms of dizziness, you should take immediate precautions. Not simply iron deficiency and anemia, such a sudden change of position can be implicated in the health of many internal organs such as the heart, blood pressure, brain, nervous system. So see a specialist right away if you feel dizzy after the test. Asterisk warning: blood pressure. You need to know your blood pressure readings. This is a routine health check you can and should do at home, according to cardiologists. Until recently, the person was diagnosed with high blood pressure if the reading was determined to be 140/90ths of a millimeter of mercury. But last year, the American Heart Association set a new threshold of 130/80ths of a millimeter of mercury. How to accurately measure blood pressure. Do not sit cross-legged, feet on the floor. Do not smoke or drink caffeinated beverages before taking the measurement. Pay attention to take a little rest before taking the measurement and take the measurement in a calm state. 6. Check for risk of liver, kidney, stomach, respiratory system disease and more. Asterisk health testing with 1 stroke in 1 minute. Use a regular spatula to scrape the surface of your tongue to get the mucus on top. Then, you put the spoon in a plastic bag sealed. Put this bag under the light. Check the spoon after 1 minute. If it does not appear stains or unpleasant, you have no health problems. If the spoon appears stained or has an unpleasant odor, you may be at risk for a number of health problems, specifically, bad, strong odor, warning for lung or stomach problems, sweet smell, diabetes warning. The smell of ammonia, warning about kidney problems. If the spoon has a thick white or yellow coating, you may have a thyroid disorder. If the spoon appears purple plaque, you may have bronchitis, poor blood circulation, high cholesterol. If the spoon appears white plaque, you could have a respiratory infection. Orange. Kidney disease, liver disease. Warning. You should go to your doctor to have a health check right away to minimize the unfortunate risk that may occur. 7. Stand with your legs crossed to check your bones and joints. This health test is extremely simple, you can take it anytime and anywhere. You need to sit on the ground, cross your legs, then slowly straighten up and then sit down again like the original posture. Repeat 5 to 10 times. According to Dr. Kelvin Chu, director of the Changi Sports Medical Center of Singapore, this exercise can test the muscle strength, flexibility and joint system of the body. If you do this easily without any help, your bones and tendons are pretty good. According to the European Journal, people over the age of 50 who still take this health test without difficulty live twice as long. 8. Hold your breath to check the health of your lungs. Try holding your breath and setting a timer to see if your lungs are as healthy as you think they are. Take a deep breath, then hold your breath. If you can hold your breath for 30 seconds to 1 minute, you can rest assured that your lungs are working properly. All of the above self-checkups are extremely simple, easy to apply and highly accurate. Prevention is better than cure. You should practice the habit of regular self-check to protect yourself and your family members. After the self-health check at home, if you notice any of the above signs, stay calm and see your doctor for a timely checkup. The most sincere advice from experts for you is to have periodic health checkups at least once a year to detect potential risks early, and then have solutions to prevent and treat promptly. The warning of industry's leading experts: do not let your body call for help. At that time, it will probably become too late. And your ability to cure the disease is unlikely. Wishing you and your family every day healthier and happier.